Hello, Newport News. I want to thank you for joining us tonight for this important discussion. You know, throughout the country, youth have been a major force in change in ideas and change in action. Hello, Newport News. I want to thank you for joining us tonight for this important discussion.
Addison, go ahead. You're live.
Good evening. I'm Addison Parker Davis, Chair of the Newport News Mayor's Youth Commission. Our commission is a group of students from throughout Newport News who are all driven to serve their community as the voice of the youth. I'm proud to be here tonight to take part in this important discussion. Mental health conditions affect many of us in lots of different forms, from anxiety and depression to eating disorders, and sometimes self-harm. Things have gotten worse due to COVID-19, and the number of suicides and drug overdoses has increased. The Mayor's Youth Commission partnered with the Newport News Police Department's Young Adult Police Commission to start this conversation. We want to save lives and talk about things that aren't often discussed. Tonight we will hear from industry experts, answer some questions we all have, respond to the messages you share on Facebook, and learn some talking points we can share with our friends and our families. Tonight that's a lot to accomplish, and we only have 1 hour. So we all know this will be the first of a series of community conversations. To get things started, we have a message from Mayor McKinley Price.
Hello, Newport News. I want to thank you for joining us tonight for this important discussion. You know, throughout the country, youth have been a major force in change in ideas and change in actions that we have in our country. And tonight we're going to talk about a subject that's not easy to talk about, mental health. But even if you don't talk, we want you to at least listen. You can exchange ideas and talk about things that are going to be helpful to others. And if you see someone that may be a little different than what they usually are, reach out to them, especially if they're quiet and reserved. It is important that we talk about this subject tonight. It is important for us to listen. I'm not going to be able to participate on the panel tonight, but I will be taking notes and listening to what you say. So once again, I want to thank you for participating, and remember that your voice is important, and we look forward to further discussions. This will not be the first and only part of this. Thank you so much.
Thank you, Mayor Price. I'm Cameron Hibler with the Young Adult Police Commission. I am a student at Gimby High School. Student mental health is a serious matter. We know students struggle with anxiety and depression due to everyday life and the COVID restrictions we're experiencing right now. We also know students are more isolated due to spending their school year in virtual learning. Reintegrating into less restricted social environments can be a challenge for our peers. Fortunately, I've been able to interact with my friends who serve with me as Young Adult Police Commission, also known as YAPC. Chief Steve Drew created YAPC to build a better relationship between the Newport News Police Department and the youth in the city of Newport News. YAPC provides an opportunity for youth to have a voice in the city about issues that affect us. We are here to express our voice today. Welcome to the Youth Mental Health, Emerging from the Pandemic to New Social Norms. We hope this forum represents some of the mental health concerns youth are having today. And with the help of our guest panelists, we provide supportive feedback to our peers. Chief Drew is joining us this evening and will now say a few words. Chief Drew.
Well, Cameron, thank you very much. And first of all, thank you so much for putting this panel together, all involved with great collaboration between the Mayor's Youth Commission and the Young Adult Police Commissioners. And I could not agree with Mayor Price more. We have a lot of conversations in our line of work about youth and community and things that we struggle with. And I think sometimes we may forget that some of the things that we as adults struggle with affect our youth. For you to be together and the panelists we have on, I could not be more impressed and more excited about this conversation tonight. I hope that we hear about some struggles and some signs. I hope people speak up and how do we hold these conversations? I think that the youth can bring a lot of people to the table about some topics that are hard to discuss. So I'm gonna step back. I'm gonna listen. I'm gonna take notes and take a lot in. But to all our panelists, I could just not be more impressed with you. And I thank you guys, both entities, so much for working together and having this great conversation. So thank you very much, Cameron, and we'll talk a little bit later.
Thank you, Chief, for supporting this discussion and the work we are doing. We're now going to hear from our panelists. First is Brittany Peterson, licensed clinical social worker with the YAPC Foundation Incorporated. Brittany.
Good evening, everyone. My name is Brittany Williams Peterson. I am a licensed clinical social worker. I work as an outpatient therapy with AFI Outpatient Mental Health Services. I service individuals in the 757 with issues concerning depression, anxiety, trauma, loss, grief, transitioning, whether you're recently married, recently divorced, transitioning into high school or college, transitioning out of high school or college. I work primarily as an outpatient therapist virtually right now due to COVID. However, I do see clients ages 18 through 45.
Thank you, Brittany. Joining us now is Tuesday Johnson, art therapist, resident in counseling, and owner of Closing the Gap. Tuesday.
Good evening, and thank you for having me as a panelist for this especially important topic. I would like to start by praising the youth for expressing their need and creating a space for youth mental health discussions. I am Tuesday Johnson. I'm a registered art therapist, as Cameron said, a licensed resident in counseling, and the owner of Closing the Gap, LLC. Art therapy might be a profession that's unfamiliar to some of you guys, so I want to give you a little context about the profession. Art therapy is facilitated by a professional art therapist. It utilizes art making and the creative processes as a vehicle for self-expression and presenting concerns and issues when words are not available or desired. Art therapy, contrary to its name, does not necessarily focus on the product, but the process. So you don't necessarily have to be artistically inclined to participate in art therapy, and age is nothing but a number. Art therapy for everyone. So as an art therapist, I have worked in different avenues with the youth in terms of juvenile detention to private practice, residential treatment centers, as well as in-home crisis stabilization. I've addressed issues presenting problems not limited to anxiety, depression, substance use, suicidal ideation, trauma, and PTSD. With experience and research in mind, I created Closing the Gap LLC, which is a business that focuses on BIPOC mental health and wellness. And BIPOC is an acronym that stands for Black, Indigenous, and people of color. I provide individual and small group mentoring, mental health services to include brief therapy and referrals to my clinical partners who are licensed clinical social workers. And I provide trainings and workshops to improve diversity and inclusion within mental health programs on the graduate and undergraduate level. Thank you, Cameron.
Thanks, Tuesday. Our final panelist is Antone Green. Antone is a certified prevention specialist and coordinator of prevention services for the Hampton Newport News Community Services. Antone.
Well, good evening, everybody, and thank you all for having me. Like Cameron said, my name is Antone Green. I am a certified prevention specialist and the prevention coordinator with Hampton Newport News CSB in prevention services. Hampton Newport News Community Services Board is the behavioral health center for Hampton and Newport News that we service children, families, and adults on behavioral health needs and substance abuse disorder. Within prevention, we offer a lot of community services to the community for children, youth, and families around trauma, resilience, mental health trainings, prevention about substance abuse disorders, so those e-cigarettes and marijuana and underage drinking, and a lot of community family programs like Strengthening Families and other community trainings like mental health first aid and ACEs. And thank you all for having me.
Thank you to our panelists for joining us this evening. We are going to begin the discussion portion of tonight's event. Cameron and I will be asking tonight's questions, and joining our adult panelists will be two youth panelists, Lavender Oman with the Young Adult Police Commission and Haley Miller with the Mayor's Youth Commission. The Mayor's Youth Commission and Young Adult Police Commission work together to come up with a set of questions for our panel. We want to hear from everyone else watching too. Please post your questions and comments in the Facebook chat. Now, let's get this discussion going. I'll start with the first question, and I want to pass this one to the youth panelists. How common do you think mental health issues are in the teen population today?
Based on my experiences with me and my friends, they're rather common. At least low levels of anxiety and panic attacks seem to be rather common within my friend group and even outside of it. And just general not mentally well, not necessarily disorders, just generally not being mentally well.
I'll add on to that because from what I've experienced, a lot of kids, especially with school areas, seem to struggle a lot with stress and balancing everything, not necessarily meaning that they have a mental disorder, but they could use the assistance and help to generally be more okay and happier.
Thank you, Lavender and Haley. What are the different types of mental health disorders / disabilities that exist?
So there's over several different disorders or challenges that exist out there in the world. Some of the top for the teens are anxiety or depression or eating disorders, to be example.
Some of the common disorders that you'll see with your school age kids will be ADHD or attention deficit hyperactivity disorder, conduct disorder, oppositional defiant disorder. Those are some of the ones that you'll see primarily with your elementary school kids, your middle school kids, and some of your high school kids.
And I want to chime in and add substance use disorders, as well as the trauma and PTSD components.
So our next question is, what are the warning signs that a loved one is suffering with mental health issues, and what are the best ways to help them?
Warning signs can be specific based on the person. They look very different depending on the situations that a person is, dealing with. It could look like withdrawing, isolation, overeating, undereating, angry outbursts is one of the big ones that you'll see, especially with your youth. substance use, hanging out with different groups, not different groups than what they would normally hang out with, and not hanging out with groups that they would normally hang out with.
And some of the ways that you can best help them, I would say, is just to let them know that they're not alone and ask what you can do to offer them support. And make sure when you're asking that it's in a non-judgmental way and that it shows that you are genuinely concerned about them.
And one of the other big warning signs is that withdrawal. So if you're close to a friend and you notice that they're not engaging or not participating in the things that they enjoy, and they're keeping to themselves and they're either sleeping a lot more or not interested in all those things that they love doing, check on that friend. Have that conversation. Are you okay? Is there anything I could do to help you? Do we want to do something together to keep you going and things like that? So just checking on that friend and being that friend and really watching how they interact.
Even your strong friends, making sure that you're checking on those strong friends too, because sometimes even though I'm smiling, even though I'm happy, I could also be hurting on the inside. So making sure that the friends that are even happy, that you're just checking on them too.
I don't think there's necessarily a wrong time to be practicing good mental health. I think that's just something that's a constant need to be worked on. And so with me and my friend group, we keep a really open conversation about our mental health on any given day. And you can tell when someone's getting particularly worse because they'll stop talking about it.
And I'll add that sometimes when your friends do become withdrawn, it is also important to sit in that silence and to be comfortable with them. And that's also another sign that you're showing them that you're there to support them.
I have a quick follow-up question. Are the warning signs that you all mentioned always indicative of mental health issues?
So not necessarily. One of the biggest ways to tell difference between normal and a warning sign is that extreme change. So if all of a sudden, like we were saying, if your friend is energetic and engaged and outgoing and wants to do a lot of different things with you, and then all of a sudden they stop off or they withdraw completely and not engage no type of way. So that's a warning sign. But if friend, as you grow and you develop, especially middle school and high school, you get new friends, you do new interests, that could be just regular adolescence. But that's extreme mood changes or those extreme different groups of social engagements is one of the biggest warning signs.
I would like to add too that school in general is pretty stressful, I found. And so even though a person may be exhibiting these signs, it may just literally be a lack of sleep. That's a very common thing to happen with the people I hang out around with. It's just literally not getting enough sleep at night. But also checking to make sure when people use those excuses that it's not just excusing away other things. So yeah, I didn't sleep last night. Well, why didn't you sleep last night? Well, I had a lot of nightmares. Discussing those things in a little more depth, not necessarily pushing them to answer, but saying, hey, if you want to talk about it, I'm here to talk about it, or even opening it up and putting yourself there first. Be like, yeah, so this was something I was dealing with. Do you ever deal with something similar?
Well, thank you guys for answering that question. I believe the next question will be from Facebook Live. Some people don't associate trauma with mental health. What suggestions do you have helped friends make that connection so they can begin to get help?
In my experience, I believe it starts with a conversation about what trauma is. A lot of times people associate trauma with the things that you see on TV, whether it's Criminal Minds or Law and Order SVU, rape, sexual trauma, physical trauma, neglect, when in actuality, trauma looks very different to several different people. So having a question about what it is that you're actually going through, and I like to describe them as big T trauma and little T trauma. And big T trauma is your rape, your neglect, your physical abuse. And those little T traumas is my friend just got killed and I'm trying to cope and I'm trying to deal with that. Or my dad or my mom just left us and I'm trying to cope or I'm trying to deal with that. So really having a conversation, an in-depth conversation with your friends about what they're experiencing, and then trying to relate it back to, is this a big T trauma or is this a little T trauma?
One of those other ways that to address that trauma is just that overall connection. So as a young person, if you have that caring adult that you trust and have that conversation along with your friends, but somebody that you can be open and honest with and express how you really feel, how it really affects you, and then that could help build upon that resilience and help you bounce back into your normal engagement.
For our next question, how do I know if I'm sad or if I have a mental illness? Am I just sad?
So with sadness and depression, they look a lot alike, but in the same time, they're very, very different and very unique. So the difference between sadness and what I would like to say mild depression or major depression is the frequency and how often you're experiencing these symptoms, the type of symptoms that you're seeing, and the length of time that you've been experiencing those symptoms. So I can be sad today, but if I'm sad for 2 and 3 months at a time, that might be something that can be a warning sign that I might need to reach out to a professional for help or tell a friend and go with a friend to seek out some professional help.
And one of the other differences between sadness and depression is how it affects your daily life. So if you could just be like Ms. Brittany was saying, that you could just be sad about a situation or sad about something happened, but then if it starts affecting you not getting out of bed or not eating or doing things that you enjoy doing, that transitions over to that depression state.
Yeah, and just to follow up, you kind of want to ask yourself, is this a long-lasting sadness or irritability? Am I experiencing extreme highs and lows in terms of mood, excessive like fears or worries or concerns? That social withdrawal component. And then again, what Anton said, the change in appetite or sleeping habits, those are all things that you also want to pay attention to just to kind of determine the difference between just being sad and having a mental illness, along with frequency.
Well, Haley, this question is for you. What are key words and phrases should I not say to someone struggling with mental health issues?
So that's tricky because everyone has their own different, as people will say, triggers. Everybody's going to react differently. Everyone's going to feel things differently. It's kind of like how they say if 2 people have similar mental health issues, they probably should hang out together because you don't want to have that opposite effect of it making it worse. So I know a big thing, especially as being raised in a household with a social worker, is avoid using words and making your mental health a descriptor. So a lot of people will say, oh, they're depressed instead of a person with depression. Be careful of certain words that could potentially be triggering, and just overall, it's different for every person. So if you are afraid of triggering someone or causing issues, just overall be careful with your words and help to understand and learn more about each person, because in the end, you're trying to help them. And the main thing is just communication and overall just being there for them if need be.
To elaborate on what you said, it's very important to listen to what the person's saying, especially when they talk about being uncomfortable, because it can be hard to tell people like, hey, this is making me uncomfortable, especially when it's making the other person really happy. Like having discussions on diets because they need to lose weight for medical reasons. Well, when I hear about diets, it's not necessarily a happy subject for me. So I ask people just not to talk about them around me because it just tends to not be the same connotation between the two of us of the word. So making sure you're listening and taking note of the things people say that they're uncomfortable with. I like to call it radical listening because people tend to not listen as much as they probably should to things. But if someone says, hey, that's offensive, or hey, I'm not comfortable with that, or anything along those lines, just try to make sure you're keeping away from those topics or making sure you're not using those specific words.
And like the panelists on here said, triggers are very, very tricky and they're very person specific. You know, an individual is not responsible for your triggers, but it's very, very important for you to be aware of your triggers and being able to communicate in an effective and healthy way that, hi, this bothers me. I don't like when you say things like crazy. I don't like when you label me as a depressive or a bipolar. So being able to really understand from an empathetic perspective when someone says that bothers me, and that's a trigger. Again, no one is responsible for your triggers, but you also want to be respectful of a person's triggers if they tell you so.
So our next question is again from Facebook Live. Sometimes parents can be dismissive of young people's expressed concerns about their mental health. Go outside and play. Back in my day, kids were tougher. Are there any avenues a young person can take to get professional help without the initial support of their parents?
So that's kind of tricky, Addison, especially if a child is under the age of 18. Because you do need consent forms to be able to see a licensed therapist or, even a bachelor's level therapist. However, talking to your school counselor is a first step, and having that support from your school counselor to have a conversation with your parents that, hey, it might be beneficial for Johnny to talk to a licensed therapist, maybe once a week, maybe every 2 weeks, but that is a first step. Or even any trusted adult that you can share that I'm having issues, and they can be a supportive person in your life when you do have that conversation with your parents that you want to seek out professional help.
Yeah, starting in school is one of your biggest resources. So you have your teachers, your guidance counselors, your assistant principals, your principals. So having that conversation with those adults that you see on a regular basis can start to open that, and then they can transition that conversation with your parents.
From what I've seen, when people tend to be dismissive of these things, it's usually, well, I don't experience it, so what's going on with you? Well, if your parents are being rather reasonable in the situation, because that's not always the case, unfortunately, but if they don't just quite not understand what's going on, or necessarily to the degree of what's going on, be like, well, it's a little different than what you're talking about, or it's a little more severe in this case. A lot of parents don't want their kid to go through these things, so they'll just pretend like they're not, and that's not healthy, but definitely what some parents do. And so taking it out of the perspective of this isn't that big of a deal, and start putting it into more perspective, giving maybe some specific examples if you can, or just saying, hey, just the one time with the therapist, and if it doesn't work out, then we don't have to do it again. Things of that nature, just trying to be step forward instead of whole steps, if that makes sense.
I think it's also fair to say that not always it's parents just kind of not wanting to help you. Sometimes people just don't understand. A big thing is a lot of getting rid of that stigma of mental health, because there's still a lot of people today that think that having anxiety, depression, ADHD, that means something's wrong with you. And simply it's just a lack of communication. So in some cases, if you can get a school guidance counselor, work on maybe finding a mediator, find some sources of information, and just overall understand that you do grow up in different generations. your childhood is very vastly different than your parents and their grandparents and etc. So be understanding, but you also need to try to find help in your own ways. And best of all, always do your research.
And don't underestimate the power of an I statement. Being direct, I feel XYZ because XYZ. There is power in speaking your truth and speaking from a first perspective.
This question is for my fellow youth panelists. How has COVID directly affected you?
So besides the general, oh, I'm not in school anymore, overall disconnection, for me, I'm a very routine and structurized person. I've had to be. I was diagnosed with an autoimmune disorder at a very young age, so I had to be on that schedule. So with everything just kind of going out the back, it's been hard for me to change. I've had to learn to cope. I've had to learn to adapt and adjust to a schedule all virtually for something I've never done before. And while it's terrible and there's been horrible things, I've had to learn to make the best of it and overall understand that things will get better and that it's just learning and growing.
Although I very much enjoy socializing with people, I'm also generally pretty fine by myself. I've taken up additional crafts to what I was already doing to fill my time instead of necessarily socializing with the people I would at school. I will say I've been able to take more personal time within this time of school. So I've been able to look in myself and find ways of making this a more positive experience. But I do know a lot of my friends are struggling just being stuck in the same place with the same people on a constant basis. So being able to add little new things, like somebody was talking about having a talent show of all the things we learned during the pandemic. And I'm like, yeah, that'd be fun. You know, bring out some board games with your family. I know wild actually playing board games, but bring out board games with your family. Bring in new topics. I mean, not controversial topics necessarily, because that could make things worse, but bringing in new topics and happy things and sitting down and watching a TV show together if you don't feel like talking to each other, but feel like doing the same activity because you're all in the same house anyways. Getting to strengthen those relationships, if that's possible, I think is important. And then for keeping in contact with people outside of your household or that you would normally see in school, because I haven't gone back to school yet, making sure that you're like calling up with them and yes, having a personal Zoom meeting with them or having a Discord open with them, something to make sure you're all keeping up and checking up with each other, even if it's like once a week, I think is particularly important.
COVID has been very unique. I've been coping with COVID over the last year, virtually seeing my clients through Zoom or some other virtual telehealth platform, which is been very different because I am a very in-person type of clinician. Other than that, just seeing how COVID has affected so many people in so many different capacities, whether losing a loved one, whether losing a job, whether, kids just not being able to go to school every day and do those activities, especially my seniors, doing those activities such as prom and graduation and things like that. It's been really difficult to help and teach how to cope with these things that are out of our control. And that's how I've been coping with it and how I've been teaching and helping my clients cope with it also, is looking at things from the perspective of, is this something I can control? And is this something I cannot control? And if I cannot control it, how do I make this better for me? What are some things that I can do to occupy my mind? Like one of the other panelists said, picking up crafts, being more involved with family, being able to do something that you may have been putting off for some time. And then the things that I can control, I know that I can't go back to school. I know that I can't stop the pandemic from happening. I know that I can't not wear my mask outside. So try not to put so much energy into the things that are outside of my control.
I will say if there is one silver lining of this whole experience is luckily we're in the era of good technology. So even if I can't see my friends every day, I can assure you that I am chatting, texting with them. We're able to play online games. We're able to use Discord servers. So we've adapted, we've overcome a lot of things. And it sucks that it's not the in-person, but we're in an age of technology. Might as well utilize it.
I just thought about this. Something that's made me really happy about this transition into doing new things. Me and my mom make our own masks, so I get to make masks that match my outfit. And it brings a sense of happiness and connection to the thing that you have to wear. I think bringing just a little bit of extra special to what you're doing already.
And I'll say, I, like Brittany, have transitioned to telehealth therapy from in-person, and that was extremely hard for me to adjust to. And not only for me, but for my clients as well. But some of the things some of the skills that tools that I've utilized is just taking breaks, setting boundaries. Like Brittany said, you can only control what you can control, and what you can't control, you can't control. So not to take on that as an additional stressor. I'm an art therapist, so I make art. That has been something that I've kind of utilized throughout this pandemic to just get all of the thoughts that come along with a pandemic out, and staying organized and trying to plan ahead. I recently started to do more meditation and practicing mindfulness. Just, you find your niche and you kind of use that to your benefit.
And that's kind of been the same for me for during COVID, is finding that routine and keeping consistent, and learning from these experiences and how I'm going to be able to grow and develop later on in life from these connections and these new relationships that I formed during COVID. But just how do you grow and develop internally from that, and making sure you take that time for yourself in technology and engaging and checking on others, but still doing that self-care, doing that mental and physical check-in for yourself to make sure you're good before you pour out everything you have.
I would like to take this opportunity to thank our panelists for their insight thus far before we jump into our next question. So thank you all. Depression and suicide rates have gone up during the pandemic. How can I bring up the conversation of mental health with a friend?
I would just say, bring it up. There's no need to sugarcoat it. If you have this concern, you have it for a reason. So be direct, be non-judgmental in your approach to the friend. Some conversation starters for addressing depression and suicide is, I'm worried about you because you seem sad or withdrawn or isolated. And you also might want to kind of become familiar with some of the signs that a person may be suicidal, so that you can know what to be aware of in terms of interacting with your friends. Ask how you can help. You can provide them information or resources that they can use to get support if they are feeling depressed or suicidal.
And just to kind of piggyback off of what Tuesday said, as far as suicide, take every comment, statement serious. I don't care if you feel like they might not do it or part of you feel like they won't do it. Take it very serious, and that could be just letting them know, hey, I have to tell somebody about this because I'm concerned. You made this comment, so there is something behind this comment, so letting them know that this is not to hurt you, but I'm trying to help you. I'm trying to make sure that you're okay. So I have to tell my mom, or I have to tell the school counselor, or I have to tell our teacher, or I have to tell your mom. So making sure that if a friend says, I've been thinking about hurting myself, or I want to hurt myself, that you're taking it very serious.
And don't worry about being a bad friend because you told a parent or, you reached out to a resource for that friend. You're actually being a better friend because you did those things. So that's something that I want you guys to actually be aware of. Good friends don't let friends suffer in silence.
And one of the ways that since we were talking about suicide, that you don't have to do that alone. I know a few minutes ago they put the suicide hotline on there, and that's a great resource for youth and for adults to use for connecting with that experienced person or the professional person. And they have it in English and Spanish and other languages. So that'll help you with that, having that conversation, having that direct conversation, and getting that person the help that they need immediately.
Yeah. When I want to discuss the mental health of my friends, I'll usually start discussing my own. And because I'm open about it, other people tend to be open about it. And also making sure that they know these are the times that you can call me. You can call me in the middle of the night. That's fine. But these are the times you cannot call me. So usually during like school and things of that nature. But I'm here to talk whenever you need to talk, or here are some other people that you can talk to. Here are the resources that I have for you. You don't have to talk to me, but you should probably talk to somebody. Things along that nature. I find that opening up yourself a little bit, being a little bit more open about yourself around people will tend to, at least slowly, people will start to open up around you. And that way you can make sure they're getting the actual help that they need out of that.
Add on, I think it's fair to say that not everyone's going to always want to talk, and not be anything against you, but sometimes people just don't want to talk. They don't feel comfortable, and that's nothing against you. And a big thing is just letting them know that you will be there for them. If they want to talk, you're there to talk. But if you do feel that they aren't talking and you are scared that something is going to happen, reach out. You never know what's going to happen. There's warning signs, and the big thing is, if they say I'm fine, they're usually not. So be careful. When it comes to mental health, and especially suicide, take precautions and never wait, because once it's over, it's done. You can't go back. You can't change it. So let them know you care. Let them know they have a source, and find someone to talk to if need be.
And to add on that, one of the biggest anxiety reducing for somebody in a suicide situation is you see them. So letting them know what you notice about how they've been different. So I noticed lately you've been, or I'm worried about you doing such and such. So letting them know that somebody sees them helps lowers that anxiety, lowers that situation in that crisis situation.
Thank you all again. In the same vein of being there for our loved ones, if a friend or loved one is going through, say, a depressive episode, how should we support them through that situation?
Sometimes your presence is literally just enough. Being there and them feeling that you're there, the energy that you're giving off is sometimes just enough. Like Haley said, everybody isn't always ready to talk. Everybody's not always open or able to verbalize what's going on. But the idea that you're here, and I know that you're caring and your presence is here, speaks volumes. So even if you're asking those open-ended questions to kind of get them to talk about what's going on or what they're experiencing, if they are not receptive to that, sometimes just being there is just simply enough.
And while you're being there with them, it's okay to be there with them in silence. You don't have to assume the role of the person that knows all the answers or has to provide advice. It is okay to sit in silence and be with them. Like Brittany said, sometimes that's all that's needed. I also wanted to add that you can also be there just by caring, checking in, letting them know that you're going to be there for them over time. And then just revisiting and offering support just to continue that, just to continue.
And then if your friend does open up, in whatever way they want to express themselves. So showing that you're actively listening to them. You're not on your phone when you're having that conversation if you're in person, or you're not watching TV or doing whatever, but you're actually listening and engaging in whatever they have to say and taking it serious.
I think it's also important to add is you're their friend, not your therapist. Understand your boundaries, especially to anyone that's younger. Be their helping hand, listen and help guide them. But in the end, you can't help fix them because it's not really as simple as that. You have to understand your boundaries and be there and just be that helping presence. But if need be, make sure that you're there to guide them to get help, because in the end, you can't play both roles.
And I'm glad that everybody is kind of talking about that active listening. You know, one thing that is very important when listening is asking your friend, am I listening for you to just vent, or am I listening so that we can problem solve? Because that makes a huge difference. Some people don't want you to help them solve the problems. They just want you to listen. And some people are really asking you, hey, I'm talking to you. I need you to help me.
And then there are like physical things that you can do for them. I put together little care packages for my friends, like had their favorite soda and their favorite snack and maybe a little coloring book or something. And the response you get out of giving gifts at a time of year that you're not supposed to give gifts, or just kind of going, hey, I remembered you like this soda, can speak a lot on your relationship with the person. It can also be a reminder of, hey, I thought about you. You can come talk to me. Like, you can think about me and we can come talk. Or we could just, sit on the phone quietly. I've done that too. But I think giving physical gifts, or like, if you can, in person, just like doing the dishes. If it's a family member specifically, doing the dishes can be quite a big thing to do. Just doing a little vacuuming or dusting or making sure the laundry's done so that they have clothes tomorrow is the little things that might not seem very big to you, especially when someone has depression, can be a really big difference. Sometimes the little things are the hardest things to do.
And I'm glad you brought that up, because a lot of people just don't like physical affection. So I know that when I have friends that are upset, for one friend, I know she loves those fun, weird socks. Find a pair of socks, get them for her. Some people really love the hard candies but hates chocolate. Okay, hard candy for you. You like this? Is a big thing is knowing that you're thinking about them and you understand them. And I can tell you that it can honestly make their day.
I have a question for one of our panelists. What tips do you have for managing time when it comes to juggling schoolwork, activities, even social time?
I have a list. I have a little stack of sticky notes and just literally writing every single thing down. Sometimes I'll write like a bigger heading and then the little steps that need to get done, because my brain gets so scattered. I do one half step here and a half step there. But having the list just there, and then having both an online calendar, and my family has an in-person calendar because we have 5 schedules and that's wild. But having the online calendar so that you can make sure you have it there. If you go somewhere and someone's like, hey, can we hang out on Wednesday? Be like, no, I have YAPC on Wednesday. I can't do it. Things of that nature tend to assist me in doing it.
Planners. I use a planner religiously. I write down every single assignment I have. If I have a meeting, Mayor's Youth Commission, even though it's a weekly thing, still write it down. When I finish it, check it off. So it gets that satisfaction that, hey, I actually completed something. I did something. Write down everything that you need to accomplish, whether it be something schoolwork or something as small as chores. Write it down and keep it structuralized so that you have a visual instead of being more likely to forget it.
And in addition to the planner, we all have smartphones. Everybody has an iPhone or Android, whatever it is that you have. We have a calendar on that phone. Plug in the things that you need to get done and set an alarm. Well, okay, 30 minutes prior to what I need to get done, I know that I'm going to get my phone going to vibrate or it's going to ring or whatever the case may be. Utilize these smartphones for what they're designed for, other than social media and texting and calling people.
And set boundaries. You don't have to do every single thing. It's okay to say, no, I can't do this. I cannot give this my attention at the moment. They'll understand. And if they don't, that's okay too, because you're looking out for yourself at the end of the day.
And also being consistent. So keeping your regular schedule and making that time for yourself with that self-care part, but being consistent with your schedule and how you structure your life and things like that.
Sorry, one more thought. This is probably the art therapist in me, but there is something so gratifying about crossing things off of your list, checking them off. So again, going back to that planner and staying organized, even your phone, it's lit up when you haven't done it, but once you've done it, it kind of dims a bit. That offers me gratification. I don't know about you guys, I might be telling my age, so.
I'm a doodler. I doodle in the corners of all of my notes. And so I have my list pad right next to me while I'm doing school. So to make the list of things I have to do a little more enticing to look at, I'll just do little doodles on it to make me just a little bit more happy about looking at what I'm doing, make it a little bit more appealing for me.
I will say I have invested in colored highlighters and pens so I could organize everything, just so if I have to look at it, it's at least fun to look at.
Thank you to our panelists for their tips and tricks. I believe that we have another question from Facebook Live. So for those of us with mental disorders, what are some coping strategies that we can use to help calm ourselves down?
Deep breathing is one of my favorites. I am very mindful, so deep breathing, meditation, journaling. Sometimes literally all you need to do is go outside and get some fresh air. The sunlight, vitamin D. If your vitamin D levels are low, that raises the chances of depression and anxiety. So even if you're not, not a big outside person, just going outside for a few minutes every day to get that vitamin D from the sun can help shift your mood tremendously. Being sure that you're taking time for you, self-care. You cannot pour from an empty cup at all. So if we're human, we're all human. So some days we're going to have good days, some days we're not. Being able to identify what is a good day and what is not a good day, and being able to say, you know what, I'm going to take care of me. I'm choosing me. I'm putting me first. Those are some of my helpful tips.
Brittany, my list looks really similar to yours. But I add Zentangles and anything that really offers repetition to get that whatever I'm dealing with out. Staying organized again, exercising, and Brittany, the deep breaths for me.
It's going to be different for everyone, so I say the main trick is find something that's going to ground you, because sometimes I will admit meditation and deep breathing doesn't always work for me, but I found that reading, overall just drawing, sketching, just anything that can get me distracted for whenever I go into little spirals of anxiety. Just doing whatever you can that's going to ground you and make you happy in whatever you do to de-stress.
And using your supports, whether it's your friend, whether it's a parent, whether it's a teacher, whether it's a counselor, using your supports and reaching out, and just saying, I'm struggling today. Today's not a good day. And it's okay to not have a good day.
I often take whatever is happening emotionally and put it outward a bit. So I use a lot of STEM toys. Self-stimulatory behaviors is something I do on a regular basis. I mean, my vest is just like covered in little things I can mess with. And then I bike. Well, actually, I tricycle. I have a giant tricycle. I bike it down the street. But just being able to go out, do some fresh air, maybe go closer to the woods and see the trees and see other living things. And going out with my dad loves to go find new restaurants. So every once in a while, like once a month, we'll go to Williamsburg and look for a new restaurant or something, doing little things to keep you reminded of how good things can be, or just reminding yourself what good things are, to help keep you grounded. I found that making sure you have that one day in a month just to do something, anything it is, anything that makes you happy. I do a lot of art. I make a lot of things. And just sometimes writing down whatever it is, just writing it on a piece of paper, it can make it easier for you to tell somebody else what's happening, and it can make it easier for you to process what's happening, exactly what's going on. Because, your mind gets a little jumbled by itself. Got 3 different trains of thought going at one point, and you're not quite sure what's happening there.
Well, those are all some great responses. Thanks for speaking. I believe this next question is from Facebook. What's up with the stigma behind mental health illnesses?
So for a long time, people believed that going to a therapist meant that you were crazy. And I am not a fan of the word crazy. I don't like to use it in any capacity. So a lot of the stigma was one around people not understanding what actually mental health is. And a lot of it comes from media. Movies portray mental illness as you need to be hospitalized or in a straitjacket and things like that. So when people were experiencing things that were outside of their norm, okay, I'm worrying a little bit more than normal. I'm sadder than I would normally be. They attributed that to, okay, am I going to look like how mental health is displayed for the public? So a lot of times stigma comes from just the idea of people not really understanding what it looks like and not taking the time to educate or ask questions about it.
One of those other labels with stigma is just the verbiage, like Brittany was saying, that we use. So not using crazy or psycho or cray-cray or lunatic to describe somebody. So using those verbiage, changing how we talk about somebody or describe somebody helps eliminate that stigma in the community too.
I'd like to add reminding to not talk about yourself that way either. Using those words against yourself is just as bad as somebody else using them against you, especially because, you're kind of stuck with yourself. And so making sure that, yes, you don't use them for other people, but make sure you don't internalize the issues going on. Dealing with mental health is not a one-size-fits-all. Some people need to be in a hospital. That's what they need. And some people just need to talk to somebody for a few minutes to make sure they're healthy. Remembering that it's very similar to physical health, where having this constant working out and constant need to make sure you're checking in on yourself, it doesn't stop necessarily. Just because you have mildly good mental health does not mean it couldn't be better, and it doesn't mean that you couldn't do something to work on it a little more, because there's always something that most people can do, and it's good to just take time and do that yourself.
I think it's also worth noting that a big part of the stigma is in modern day is we use the incorrect terminology. I know one that I keep hearing is a lot of people say the term antisocial instead of asocial. Coming from a social worker background household, antisocial is actually part of the antisocial personality disorders, which means that you're not feeling the general emotions someone else does. That's going to fall under your cluster B disorders, your narcissism, what used to be considered socio or psychopathy, which those terms don't exist anymore. They are coined. So the big thing is we use a lot of terms that don't work. The DSM will change, just kind of like Asperger's has been taken out. We use the wrong terminology and we keep saying them and then we spread them around. So there's a general misinformation given out. It's kind of like politics. There's a lot of misinformation and there's a lot of correct information. It's important to check your facts.
In addition to that, with labels, is making sure that you are not taking ownership of whatever diagnosis that you are provided. you are not a bipolar. You suffer from bipolar disorder, but you are not a bipolar. A lot of times that is also the stigma too, is that people feel like, oh, I'm bipolar, or I'm ADHD. No, you suffer from that, just like an individual that has physical health that suffers from diabetes, or they have cancer, or they have high blood pressure. These are conditions that are treatable just like any physical condition that you would see your PCP for.
And there's also a cultural component. In some households and some communities, mental illness or disorders is frowned upon, or it's a taboo. We don't talk about those things. We don't talk about our issues. We don't seek out mental health professionals. What happens in this house stays in this house. And I think overcoming that is part of what's up with the stigma as well.
And, just to kind of piggyback off of what Tuesday was saying, is understanding that you can be spiritual or religious and still see a licensed professional. You can have both. There's nothing wrong with having both.
And understanding that there's different types of therapists out there. There are Christian therapists. There are therapists that, I don't know, there's all types. There's art therapists, there's social workers, it's like build a therapist. Like there's no need to kind of feel like you can't find a person that matches your niche or, your background.
I think it's also important to say that therapy as presented in the media is vastly different from actual therapy. Most people, especially you'll find in media, use the term shrinks, and it's a lot of them just picking at you and telling you what's wrong. That usually never happens at all. The most common type of therapy that they're trying to portray is talk therapy, but in all actuality, what you're doing is you're talking about whatever you feel the need to talk about, whether it be something that happened yesterday or something major, and they guide you so that you come to the conclusions yourself. It's all about self-conclusion, not someone telling you what's wrong with yourself, but you understanding what you need to do, find the problem, and make your steps to change.
Haley, that was a really good point. I can't tell you how many conversations I've had with individuals that have said, I don't really want to go to therapy. What do I talk about? Well, you can talk about anything. Just like you said, you don't have to go in there knowing what you're going to talk about. That's for you to figure out when you get there. So
half the time I walk in without knowing what I'm going to talk about, and we end up having a very long and arduous discussion about any and everything.
See?
And just know there's also different types of therapy. So there's not just that one-on-one. There's group therapy. There's technology with telehealth, so you don't have to actually be in the room with the person. There's all different ways, but finding what fits right for you and how you can express yourself and how you feel most comfortable in expressing your feelings.
Healthy people go to therapy. You can go to therapy and be healthy. You can go to therapy and not currently be suffering from something. You can go to therapy and just be mad at your boss for 2 hours. You're paying somebody to listen to you. You're paying an unbiased person to listen to you. And just like going in for your yearly checkup with your doctor, it's probably a good decision to do something along the lines to make sure you're keeping your mental health. And you don't have to be completely not okay. You can just be kind of not okay. Or even, I'm doing great. I want to tell somebody how great I am, but I've annoyed my parents to death about it already.
Well, those were all some amazing responses. I definitely learned a lot from those. But our time is almost up. And our final question is for the entire panel. What is one thing you would like every young person watching to take away from tonight's session?
One thing I think that is important that I want everybody that's watching this to take away is to know that you're not alone. You don't have to suffer alone, and that there are people out here that can help, want to help, and are willing to help. So definitely, if you're feeling that you're a little off, or you're feeling like I just want to talk to somebody for preventative measures, know that it is okay to do so.
I guess mine would be what we've kind of talked about throughout this entire discussion. It's okay to not be okay, and you are not alone in that. And like Brittany said, just find the appropriate resources to help you with not being okay.
I guess I would say, coming from personal experience, especially being a student, you don't have to be perfect and you're not going to be perfect. It's okay to make changes. You're not going to be the same person you are in a few years, and you're not the same person you were back then. Part of life is growing and changing, and that's the beautiful part of it. You're going to be okay.
One of the important things is that your mental health is as equally as important as your physical health. So make sure you take care of yourself mentally, physically, emotionally, so you can help those that you love and those that you come across. Taking care of yourself, so like everybody has already said, that you're not pouring from an empty cup. But your mental health matters, and your mental health is as equally as important as your physical health.
It can take time to figure out what you need. It can take time for you to know yourself enough to figure out that you need something. It doesn't have to be 100% there for you to find somebody to talk to try to find what is happening and what's going on. And like everybody said, you aren't always okay. And if you are okay, that's good for you too. It's just good to make sure you're maintaining yourself as a general statement. As of everything else in your life, in moderation, make sure that you're okay and you're doing well.
Well, everybody, I really appreciate you guys for responding. I believe everyone on Facebook Live, even myself, has taken away something from this. But that's all the time we have for tonight. Thanks to our incredible panel and everyone who joined us. Chief Drew, do you have any closing remarks?
Well, I'll just be brief because I think you guys said it all. I cannot be more impressed with all of you, and just the topic is so timely. I see calls for service that we respond to continue to go up with issues of depression or suicidal thoughts and mental illness. And one thing I've learned, mental illness and those type of issues, stress, or all the things that play into that, it is not gender-based, it's not race-based, nor zip code. It plays no favorites. And I think the more conversations we have, that there is strength in each other. And I have learned a lot. And I greatly, greatly appreciate the two groups coming together and the expertise on the panelists. I look forward to future conversations, and to all those who tuned in. I appreciate there were great questions, and the panelists in this format, I think we may never know how many people you actually reached and actually helped. So I just want to tell the panelists, thank you.
Thank you very much, Chief Drew. And I would also like to thank each and every panelist and everyone who took the time to watch and share this with us. This is such an important topic, and I know we'll have many other discussions in the future. I want everyone watching to know that you matter. If you're hurting, feeling overwhelmed, or need help, please reach out. And remember to be kind. We don't know the struggles others are facing. The number for the Hampton Newport News CSB crisis line is 757-788-0011. Again, that's 757-788-0011. Or you can text HOME to 741-741. We will share information on our next discussion soon. Let's keep this conversation going. Good night.